I'm going to talk about radiation monitoring devices. First question on our list, what is this? It's a dosimeter. It records radiation exposure. How does it measure exposure to radiation? It measures the intensity of the visible light captured when we take the x-rays. How do we obtain the readings? Well, we use Marion Technologies, so every quarter they send us a report with new badges and we send the old badges back and they send us the report of what our old badges state for that quarter. We also can log in and look at them anytime we want if we're ever curious about our readings ourselves. When should it be worn? This badge should be worn at all times whenever you're taking any kind of x-ray, whether it be dental x-rays, digital x-rays, any kind of x-ray, it needs to be worn. Where it is worn, you place it on the outside of all your PPE. You have your thyroid shield, your collar, or your apron, your lead apron, and then you place this on the collar, thyroid level on the outside of your lead apron. What is the maximum permissible dose for veterinary staff annually? It's going to be 5 REMs or 5,000 mREMs. And using a dosimetry report, I'm going to show you guys a report. So for this quarter, we're going to use Rachel Verico. From April 5th, 2018 to July 4th, 2018, her quarter to date exposure was 11 mREMs. Her lifetime so far is 42. For example, mine above hers, so far it's 50 lifetime. We have another coworker, Alex. His lifetime so far is 257. But that's our current so far for Rachel. She's at 11. And then the year to date so far, because this is the second quarter, her year to date is 42. So she is below the maximum permissible dose of exposure to radiation. Proper PPE for radiology. First of all, proper PPE includes your gloves, apron, thyroid shield, and eyeglasses. At my hospital, we do not use eyeglasses. And then also, every single time you always wear your dosimeter badge. So, proper order of putting everything on. We got our gown. Slap this on, and thyroid shield, like so. I'm going to tuck my thyroid shield under my gown, and I'm going to place my dosimeter on the outside of all my PPE at collar level, thyroid level. And then gloves for when restraint must be used. Manual restraint for one thing, we must do that for some of the patients that we don't sedate. So gloves, thyroid shield, dosimeter, and apron. Proper storage and checking these items. All items must be 0.5 mm in lead thickness. Every 6 months we x-ray the gloves, make sure there's no holes in the lead. When we visually inspect them, they need to be flat at all times, and we need to make sure we can go through and check the fingers, make sure we don't feel anything abnormal when we take the gloves and we examine them. But every 6 months for gloves, we take x-rays of the gloves, make sure there's no holes or cracks. Storage, you want to keep them as flat as possible. Ends are opened to allow airflow. Dosimeters are stored separate from the x-ray suite or the radiology suite. We keep our dosimeters in a separate room because we don't actually have an enclosed room for x-ray unit. For our x-ray unit, so these are actually stored away in a separate room. The thyroid shield and gowns are x-rayed every year to ensure that there's no holes or cracks. We want to make sure that the fabric is nice and smooth, and that if we ever feel the gown, we don't feel any holes or cracks in it. But like I said, x-raying these every year, and our thyroid shield is how to actually properly check for any cracks or holes. Storage of them, thyroid shield, like so. And our x-ray gowns are always hung like a shirt. You never ever want to crinkle them up and just toss them aside. You want to hang them like a shirt or drape them over the rack. These are very expensive items, so we don't want to cause any harm to these, and by crinkling it and bunching it up or laying it folded over, we can actually crack the lead inside the vests. I'm going to talk about general radiation safety. First question on our list, state, explain the 3 methods of restraint used in radiology. Chemical, which is sedation. Manual, which is actually having a team member hold down the patient and position with you. And physical is using tethers, gauze, string, V-trough, sandbags, foam wedges. Discuss and show 3 positioning aids used in radiology. Like I said, tape, roll gauze, V-trough, sandbags, foam wedges. At my clinic, we don't have foam wedges or sandbags, so we like to use rolled towels for our items, and then we can just take the tape off and throw them in the wash so that they can become clean again. We're going to talk about our physical protective barriers that can be utilized in radiology other than PPE. That would be a lead wall, leaving the room entirely, and also they sell portable shields if that is not available. At our clinic, we actually use sedation for all the patients nearly, and we actually attempt to leave the room or stand at least 6 feet away as possible. Explain how distance and exposure time can be utilized as safety measures. Distance is talking about how you want to stay as far away from the x-ray and the patient as possible when taking the x-ray. So you want to stand as far away from possible, leave the room if you can, stand behind something lead as if you can. And exposure time, we're talking about trying to use the fastest seconds possible and using the lowest MA setting as possible as well, and only taking an x-ray once. You want to make sure your settings are correct, you want to make sure the patient's positioned correctly, so you only have to take 1 x-ray. Explain why no portion of any human, shielded or unshielded, should be exposed to the primary beam. The primary beam on the x-ray unit has the biggest volume of x-rays. So even if your gloved hand was in the primary beam and it was shielded and you had a gloved hand on, you're only reducing about 25% of your radiation exposure. That is why we wear PPE. PPE only prevents and helps you decrease your exposure to scatter radiation. But your primary beam, if you were to put anything in that primary beam, you are not protecting yourself at all, and you're not doing yourself any favors at all. So that's why nothing should be in the primary beam except what you're taking the x-ray of. Explain why non-essential personnel be removed from the x-ray suite during exposures. Unless you need to be with the patient, helping the team member taking x-rays, you do not need to be anywhere near the x-ray machine. You do not need to be in the same room as the x-ray when they're taking the exposure. X-ray exposure over time is cumulative, so the damage that you see or get done to you right now isn't going to be the final product. It is over the long term of your career. So if you do not need to be in the x-ray room or in the vicinity of an x-ray, you should never be in the area. Explain why we should make every effort to obtain a diagnostic image on the first exposure. Like I said, x-ray exposure radiation is a long-term cumulative. So the diagnostic imaging is very, very important in veterinary medicine and any kind of medical field, but the less you need to expose yourself to, the better. Every time you take an x-ray, even when you're wearing proper PPE and do everything you possibly can, you are still exposing yourself to the harmful effects of radiation. Damage to cells, damage to DNA, it can hurt your thyroid glands, all of your sexual organs, any kind of tissue can be damaged during x-rays. Explain the scientific reasoning for restrictions on pregnant women and people under the age of 18. People under age of 18, they're still developing. They are not an adult by the letter of the law, and also the algebraic formula used to calculate the REMs in a human being is set n equals the age of the human being. So there's nothing under 18 in the formula used. And for pregnant women, unless you sign a form, if you're pregnant, saying you know you're pregnant and you want to continue taking x-rays, you may do so, and that must be on file in the clinic. But radiology and radiographs in general, you are most exposed in the most serious time of your pregnancy is ages, your pregnancy, your first trimester, which is month 1 through 4. That's the most critical time of development of the fetus. So if you're taking x-rays during that time, you can severely damage yourself and your unborn child if you were to take an x-ray. And that is radiation safety. Today we're going to do a left craniocaudal image of Strudel's radius and ulna. Strudel is sedated, our sedated patient. We're going to come over here, order the x-rays. We're already on Strudel's account. Image capture. Select the left leg, and then I'm going to select our radius and ulna left DP. Now we're going to come over here and we're going to turn on our machine. She's 20.5 pounds. We have a pre-set up technique chart. 20.5 pounds, so 20 to 40 extremities. 77 is going to be our MA, or I'm sorry, 77 is going to be our KVP. Our MA is 300, and our seconds is going to be 160. Wow, it's already set to 124. So, for positioning, we're going to place her in sternal recumbency, like so. And I'm going to just pre-collimate just to see where I'm at on the table. Okay. So I'm going to tape her paw just so I know it's not going to go anywhere, it's not going to move, it's not going to pull when I pull on her. And I'm going to first deflect her head away from the affected paw with a rolled towel, like so. Mid-shaft is our centering of the radius and ulna, and I'm going to collimate just proximal to the elbow, just distal to the carpus. And I can adjust her as needed. And I want to get the lateral borders as narrow as possible to prevent any kind of scatter radiation. And I can go a little bit smaller. Left marker is going to go right next to the left side of her left paw, not in the way of the limb. So again, mid-shaft radius and ulna is our centering. Proximal to the elbow, distal to the carpus. I'm going to move the collimation laterally as close to the limb as I can, and I deflected the head using a rolled towel, or you could use a foam wedge away from the limb. I'm going to come over here, and on the count of 3, I'm going to ask that myself and my assistant close your eyes. 1, 2, 3. Wonderful. So, this is our final image. It has Strudel, the name, canine owner Melinda Straley, our doctor, radius and ulna left DP. That stands for dorsal palmar or craniocaudal, and then the date and time. I'm going to done capture it, so hit done, and then it goes to the cloud, radius and ulna, owner, dog, shot, date, time. Now, alright, so today we're going to do a VD thoracic on our sedated patient Cheeto. To set up x-rays, I'm going to come over to Cornerstone. He is on our whiteboard, so that is not the whiteboard. This is the whiteboard. Right click Cheeto. So to request x-rays, we are going to right click in his patient clipboard, come to imaging, image capture. It's going to pull up IDEX imaging, and I'm going to select the shot I want. So VD thorax is what I want. Hit done. Come over here, we have our technique chart, which is already preset to certain images. So I'm gonna do, for under 20 pounds, turn on our control panel. KVP is gonna be 84. MAs is 300, and then our seconds is 160. Perfect. So for Cheeto, we're going to place him in our tray so that his spine stays much more aligned than just holding him. Now I'm going to collimate to the body walls, and it's going to be the cranial border is the thoracic inlet, caudal border is the first lumbar spine. So I actually can go ahead and collimate pretty well. And then also to help, I'm going to tape his front paws to the table so that he is stretched nicely. Nice and stretched so I don't have to hold on to anything, and neither does my wonderful assistant Erin. So cranial border is thoracic inlet, caudal border is our lumbar spine, which actually can get a little bit smaller. And then our collimation is to the body wall. Right marker is always going to come here in the cranial area of our image, not interfering with the actual image itself because we're doing a thoracic VD. And also we have a foot pedal so that we can stand as far back as possible. And I'm going to put gloves on, even though I'm not holding him. I can't get more than 6 feet away from him, so I want to make sure that we're doing this correctly. I'm going to take our image with the foot pedal. I'm going to ask that Erin and I close our eyes or turn our heads and close our eyes when we expose the image. 1, 2, 3. Okay. All right. So this is our image of our VD thorax. We have thorax, VD, date and time, and then Cheeto. Cheeto is owned by 43rd Avenue and also, so it's going to say Cheeto and then the owner underneath, which is us, because he's our clinic kitty. Other than that, I'm going to hit done capture and it stores it to the cloud. That is our VD shot of Cheeto's thorax. Today we're going to do a VD pelvis OFA quality on Strudel, who is sedated. Come over here, order the image, image capture, click on our pelvis, and then I'm going to click on extended VD. I'm going to set up our machine, turn it on. Our technique chart is already pre-made. Pelvis, she's 20.5 pounds, so I'm going to come to the 20 to 40. 140 is our seconds, 79 is our KVP, and 300 is our MA. So for positioning for this particular shot, we're going to get a V trough, place her thorax, and also place her thorax in the trough and place her in dorsal recumbency. We're going to extend her legs using some gauze rope to help with this. You want to extend her front legs as cranially as you can. Make sure she's nice and straight. And then grab our tape. Thank you, Isabel. The hardest part about these images is making sure they're straight. Now, our beam is center to the ischiotuberosities, which is here. Cranial border is the crest of the ilium. Caudal border is going to be just distal to the patellas. And our lateral wall is going to be the greater trochanter of the femur. Now, what I'm going to do for these images is going to slide my pedal where I need to go. Marker is going to go cranial on the image. I'm going to kind of preset my image up a little bit here. Get my collimating where it needs to be. And you also want the tail as straight as possible. And what I'm also going to do is I'm going to tape her down in my trough a little bit. So, how I'm going to actually get the OFA portion of it is I'm going to grab onto her hocks, and I'm going to twist medially her stifles until her patella is right on top of the trochlear groove, like so. And I'm also going to gently pull and extend her as much as I can, while also making sure that her paws are just parallel to the table and everything is even. So this would be twist, twist, twist. This would be my image that I'm going to get. So with gloves on, since I have to hold on to her, I'm going to ask Isabel if you can move the machine a little bit caudal towards me. We slipped a little bit. Okay. So, make sure my pedal is all good. So, I'm going to twist medially to make sure her feet are nice and even, make sure her toe is nice and straight. If you could slide the machine, the head down just a little bit because we moved a little. A little bit more. A little bit more, just a little bit. There we go. And move the marker as well, just a little caudal for an image. And on the count of 3, 1, 2, 3. So this is our shot that we have. Pelvis extended VD, the date and time. Strudel, owner Melinda Striley, who is also our doctor. And that is how you get a OFA quality pelvis VD shot. So I'm going to show you how to retrieve any X-ray we took on any patient from our system, from Cornerstone and IDEX digital imaging software packs. Down here it's on the toolbar. I'm going to click. It's going to open up the imaging software. And typically it opens up to the day we're on, which is September 10th. So once it loads. So today we took pictures of Cheeto and we took pictures of Mater. I can search any patient though by going up to the search bar. And for example, copper, we took x-rays of last week. Typed in copper. Now it pulls up all the coppers that we've ever taken images of. So last week on the 7th, I took images of the copper who ate potentially a rope toy. And these are the abdomen shots of the rope, of the abdomen, looking for rope toy, looking for any foreign bodies, anything like that. And if I ever wanted to go back, I can click the home and I can search for somebody else. I can pull up any other images. Say if I wanted to look for somebody named Athena, there are 9 Athenas that we have here. So that is how we pick and retrieve any kind of x-ray shots that we need to have from packs. Today we're going to do a barium study on strudel. We're going to do an upper gastrointestinal study, which is focusing on the stomach and the small intestine. This is indicated for things like chronic weight loss, vomiting, anorexia. If we suspect an obstruction, we would also do a barium study. Ideally, we would want to give an enema the night before we do the study, and then we'd also give another enema 2 to 4 hours before we complete the study series, just to make sure that there's no gas present, there's no fecal material in the colon. We'd also ideally want to fast 12 to 24 hours before we complete the study. If they are in abdominal stress or we suspect a obstruction, neither an enema or fasting is necessary. We would place a orogastric tube and we would slowly feed the barium through that tube, but we push right through here and have her swallow it slowly. I have to be very careful because we don't want her to aspirate, and we don't want her to have any of the barium on her face or anywhere on her body, because that can create artifacts in the images as well. So what I'm going to do is get her nicely set up, and I have 35 mLs of my 55 mLs that I'm going to give. This barium is already reconstituted, but based on her weight, she's 20.5 pounds, it's 3 to 6 mLs per kg, and so that would come out to 30 or 55, but I'm gonna place the barium and slowly have her drink. Very careful, we do not want her to aspirate or get anything in the lungs at all. So far out of my 35, I have given almost half. So I'm gonna clean her up and give the rest. We would take an x-ray before I gave all this to make sure that the settings are correct for the barium study. So I'd actually take an x-ray of her abdomen, make sure the setting's correct, make sure our collimation's good, and then we would give them the barium. Now that I've given the barium, we are going to take an x-ray of her abdomen, and we're going to take an x-ray starting at 0 for 0 time, 15-minute mark, 30-minute mark, 60-minute mark, and then every hour we would continue and take an x-ray every hour on the hour until the barium has reached the distal small intestines or until we hit an obstruction of whatever we're looking for. And we would do that continuously until we get our answers. Turtle has had 55 mLs of barium. Now we are going to take our first image. It's going to be a right lateral and a VD, and we take a right lateral and VD x-ray at the 0 mark, 15-minute mark, 30-minute mark, 60-minute mark, and then every hour after that until the barium has reached this distal small intestine, or we hit whatever we've hit and we've found whatever we're looking for, either an obstruction or whatever that might be. Collimation is going to be the T4 for the cranial end. We want to also get the apex of the heart and the diaphragm in there, and then our acetabulum is going to be our caudal end of our collimation. Everyone's wearing the proper PPE. We're going to start. Take our x-ray. First is going to be the right lateral. I'm going to ask everyone to close their eyes on the count of 3. 1, 2, 3. Wonderful. Fantastic. So, go.
Hi, I am Dr. Melinda Striley. I am Reagan's preceptor for this project, as well as her boss. And I'm pleased to say that Reagan has shown some great improvement since starting this course. Her x-ray positioning has improved dramatically, which is fantastic, and she has been able to help teach some of my other nurses and support staff better x-ray techniques as well. I would say one of her strengths is that she is very dedicated to improving every single time she does something. And x-rays, again, vast improvement with positioning as well as collimating and decreasing any kind of artifact and things like that. Any weaknesses, I'd say we still need to work a little bit on spinal rotation. We still don't quite have those ribs just perfect, but again, tons better, and every single time she takes them, she looks at them, she tries to make it better the next time. So awesome, very proud.